I'm Joe Helko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has provided access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle County. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. This month's episode is titled The NCSS School-Based Behavior Consultation. Did you know that as part of our integrated care model, that NCSS has staff situated in schools throughout the area? What does this mean, and why is it important in addressing population health? To discuss the NCSS School-Based Behavior Consultation in greater detail, I'm pleased to introduce this month's guests. They are Matt Habedank, Children's Behavior Services Program Director, Amy Irish, School-Based Behavior Consultant Team Leader, Tara Lawyer, School-Based Behavior Consultant, and Dan Biebernitz, School-Based Behavior Consultant. I'd like to welcome all of you to the show this morning. So let's begin with, first, how long has NCSS been providing a variety of school-based services?
Hey, I actually had to do a little digging to find out the answer to that one. I don't know if I'm spoiling anything by saying I knew some of these questions ahead of time. It looks like the school-based services origins were in the 1992-93 school year with the school-based clinician team. And the rest of the school-based services sort of developed over time in the children's division. SOAR Learning Center started in 1999. I think they're actually getting ready to celebrate their 20th anniversary next year. Of service to the community, which isn't services in the public schools per se, but they do a lot of connecting with the schools and a lot of services to the kids in Franklin and Grand Isle counties. The Collaborative Achievement Team started about 15 years ago, and they work in schools all over the two counties now. The School-Based Autism Program was about 10 years ago. Same kind of thing, working with in all schools all over the two counties. And then the School-Based Behavior Consultation Team, which we're talking about mostly today, formally started 3 years ago, as sort of an outgrowth of the Collaborative Achievement, sort of taking the model that the Collaborative Achievement Team uses and expanding that to a little bit different type of service with a little bit different type of kids and a little different modality.
So when you think about it, you said the earliest year you mentioned was 1992. I would imagine that most people would have no idea that we have been integrated in schools, that long ago.
Yeah, I was surprised myself that it was that long ago. I knew it was prior to SOAR's opening, but I didn't realize how much farther back it went.
And as you said, Matt, even though SOAR Learning Center is a part of NCSS as opposed to being a public school, throughout the two-county area, that particular school serves all of the schools, not only throughout Franklin and Grand Isle counties, but elsewhere as well, for individuals that need those types. So let's move on to what is positive behavior intervention and support?
Sure. PBIS is something that was, it started probably in the 80s with some research around kids with behavioral disturbances and some folks that were interested in how to make change in those kids. Or to develop some significant research. In the 90s, it really took traction, putting it in the schools. And then in the early 2000s, the model came into place in which it's really a framework trying to identify a continuum of care for kids to support the behavior needs across the school, looking at sort of dividing it into a universal aspect that impacts all kids. How do we support teaching and supporting the behaviors and the positive behaviors that we really want to allocate their resources to, as well as to how do we develop data collection systems to know that the work is making a difference, and if it's not, how do we address that? So universal system within PBIS that affects all kids, so identifying what are our three basic rules that we want to, framing them really positively, supporting a system that will reinforce them and promote those behaviors, as well as developing some, how do we know in the level of care, or 2 level of care, that looking at more of why are kids doing what they're doing. The research really shows that there's all, if we know why they're doing the behavior, support them in learning skills. The PBIS model really looked at developing evidence-based stuff and curriculum for how to explicitly teach kids these specific behaviors, we have a plan in place that really acknowledges them when they are. And then a tier 3 is a really small collection of kids that need a more intense level.
PBIS is really an outgrowth of applied behavior analysis, where the group of researchers who developed it were looking to take ABA techniques, which sort of traditionally work with one individual at a time or really small groups, and pop it out to working with school populations. But the same principles with ABA really is grounded in seeking to change behaviors by modifying the environment around the individual. So they wanted to say, their central question was, how do we apply these same techniques and the same methodologies that work at a one-on-one level or a small group level to a large group of kids? And that meant focusing on things like data collection and identifying the kids who needed what kinds of support, where and in what way, and how do you arrange contingencies of reinforcement for a whole school that are meaningful to the kids and still, have a realistic impact on behavior in a way that's manageable for the staff and the teachers and the students themselves to implement, understand, and kind of run programming with. And it was really successful, quite successful.
So I think that's interesting that it was born out of ABA and there's.
Yeah, the guys who created it are a bunch of BCBAs from way back in the day, or a bunch of behavior analysts preceding the actual BCBA certification by a bunch of years. And still come around. Some of the founding researchers who developed PBIS are in Vermont once in a while and do some conferences up here and do some speaking, and I've had, and I know Amy has had a chance to go see some of them speak, which is always interesting to hear. Not, to sort of, we know what a lot of schools in Vermont are doing with PBIS, but to see what schools across the nation are using PBIS for, because PBIS is a model that's used nationally in all 50 states.
So what is your team's role within the model?
Sure. So our team has a pretty exciting opportunity within the PBIS model, in that some of the purpose of the model is really to build in capacity of a school building and some expertise. But what we know is that PBIS model doesn't always offer the full range of supports that are in-house that are needed on a day-to-day basis.
I think a big concept and a mantra of applied behavior analysis is we're not changing the student, we're changing their environment. And that's really what PBIS does. While we're not explicitly advocates, we're not explicitly foundational PBIS members, we are using it all the time in schools because it's a very useful tool. We're changing the environment to be a more positive culture so that the positive behaviors that we want to promote are promoted and reinforced. And we'll see more of those. And then when there are issues, we're targeting those with evidence and productive responses that are actually going to change behavior, and not just the old default technologies that we used to apply to behaviors. So thereby we can emphasize the good and then also accurately and effectively curtail the bad.
PBIS really, and both Amy and Dan have mentioned it a little bit, looks at providing supports to kids in schools in a 3-tiered model. So tier 1 is kind of, if you think of it as a pyramid or a triangle, tier 1 is the base of the pyramid, and those are supports and interventions that are available to all the kids in the school. Any kid who walks through the door, this is just part of the culture of the school. If you look at the research, that's about 80% of the kids in any given school respond positively and respond well to those interventions that are applied across the entire student population of the school. The next level is tier 2 level, which is a little bit more individualized level of support, a little bit more structured behavior intervention, academics, school day. So those tend to work for about 15% of the kids. and the top of the triangle or the pyramid, if you will, is about 5% of the students that need a really individualized level of support, which is often where the collaborative achievement team comes in, or the school-based autism team. Some of the NCSS behavior programs that developed initially were really geared towards meeting the kids of, or meeting the needs of tier 3 kids. And then, as we've developed in our service delivery models and in what we're trying to do in the public schools, we're really trying to push down more into the bottom parts of the pyramid. So trying to proactively get involved with kids and get involved with schools, so the kids don't ever develop into needing tier 3 supports, but rather they're caught much earlier on at the tier 1 level, and behaviors are addressed when they're not nearly as significant, not nearly as high, which is something that we've seen a lot of good outcomes with.
Now, I know we had mentioned earlier about various programs and how long the models have been utilized by NCSS, but let's revisit how long this model has been provided by NCSS in school.
About 11 years ago, a school approached us saying we have increased clinical activity and the needs and behaviors of the schools. What's a way we can come together and partner, help us meet our needs of our kids in our school? So approximately 11 years ago, we piloted our first version of this program, and we've learned a lot since that first program went out 11 years ago. I would say that we've tried several of those small pilots, and we've really focused on partnering with schools and listening to what they need, and listening to what we can offer, as well as identifying more flexible funding structures so that we can work with more kids, provide support to a greater variety of kids in their schools. So I would say in the past 3 years is when we become a really solid team that is very clear on sort of where we stand. We still are definitely partnering with back on where can we meet them where they are and be a little flexible within each school. So I'd say about 3 years has been a great.
And I think one of the big pieces in being able to take that step from sort of building it in isolated places, individual schools, to make it a program and a model that we can in almost any setting, in public school setting in these counties. It was a funding stream change, is that there was a change in funding streams we accessed that, boiled down to letting us be a lot more flexible with what our staff was able to go in the schools and do. So really being able to meet the schools where they're at and say, okay, we can do all of these things, but what is it you need? What are the things that you need us to help you with in the school? What are the places where you need input or expertise, or folks who experts in the field doing that job in the school, which has really made it, I think that's the key piece that really made it click. It really took our ability from, we have to do a lot of this stuff, and then we can do some of this stuff, to it's very, very flexible, and we can really meet you where you're at, all over the place. And I think schools, my sense is they really appreciate that, and that's been part of the draw with the schools that we partner with and that we work with very closely, is they're able to articulate what those needs are and have an identified, this is the place in our school system where we need someone to step in and we need some support from NCSS. And we say, all right, then let's do it. We can go out there and hopefully back the system in a positive.
Isn't one of the things that's a bit misunderstood sometimes is the fact that this does not cost schools more to work with NCSS, but they actually save a lot of money by working with NCSS?
If you look at the big picture, and the mechanisms of special education funding are work in mysterious ways. They're definitely a little bit convoluted. But in the long term, when you think about the cost of a contract to put one of our folks in the school versus what it costs for a school to go out and hire that person on their own, especially when you consider salary and benefits and the whole package that goes with employment, the savings is pretty significant to let us go in and take care of that job versus the schools trying to build capacity. And there's upsides, there's upsides and there's limitations to both of those models, but certainly from a wide lens, there's a definite financial incentive to do this kind of contracting.
Even more so is what I'm really passionate about, what got me onto this team, was the idea that when when we were explaining before the models of the PBIS program, where everyone falls in tier 1, and then tier 2 is needing some support, and then tier 3 is needing a high level of support. What we've noticed and what data has said over and over again is that if you give enough support in the tier 2, where they need a little bit of support, you can really easily prevent them from moving to tier 3. And so by doing that, we can keep kids out of an expensive tier 3 program and and possibly move them down even to the general setting without needing really heavy supports. And so with a little bit of evidence-based in the school, reliable practice, we can save the school and students a lot of time and cost just by giving some support early on, and that's what we do.
I think that's a great point, Dan. Because the part of the cost savings comes in by the time you get to tier 3, where probably a one-on-one staff is involved, that's an expensive level of support, where you're talking about one staff or one person. So the quicker you can get that intervention in place, stabilize whatever's going on, and move the student to a lower level of support that's typically a better, it's more economical for the school. You're saving money not just from the contracting and getting our staff in the school themselves, but for making those tier 3 supports as timely and effective and ability to transition as fast as you possibly can. There's a cost savings there. I'm glad you brought it up.
Now, several of you have mentioned the concept of evidence-based, and I just want to bring up the fact that number one, the question is this evidence-based, which I think you've already answered, but I'd like you to re-answer that. But as importantly, it doesn't mean that every model that is promoted is evidence-based. So I guess what I'm saying is I'd like you to describe the importance as to why it's important that this is an evidence-based model.
I think the importance is an evidence-based model really means that there's been well-controlled studies done on the model that have been published in peer-reviewed journals, and it expands over different populations and in different settings, and is well-researched. And PBIS certainly is well-researched. If you go in and do a little bit of research, there's any number of research articles from different research across the country, with the different ages, different school groups, and lots of different ways that the PBIS model has been implemented and applied into school settings that make it that really sound evidence-based model that you're looking to implement. And the importance is you know that it works, you know that it's effective, and you know a lot about why it works and how it can be applied to different settings, different situations, different kids, effectively to meet their needs. With something that's not evidence-based, that link is not as clear. Maybe it was the intervention you put in place, it wasn't the intervention put in place, and there's always a risk if you're not using something that's evidence-based that there's a possibility that harm can be done, whether the behaviors can be impacted negatively. When you're using an evidence-based model like PBIS, that possibility is really limited because it's been so well researched and because there's such a good foundation for the work that we're up.
And I thought it was just important to express that because, once again, when you say the term evidence-based, it's not just a couple of words. There's really a lot that is behind it. And the fact that we know that, once again, every program that hits over time is not evidence-based. So as you say, Matt, maybe it worked, but then again, maybe it won't work according to what someone says it will.
Yeah. And as not only as a professional in the field and someone that worked for NCSS, but as the parent of a couple of kids that attend schools in Franklin County, I want to know that the best care is being provided to my kids and to all the kids that are in their schools with them. That it's they're not serving as test subject for something that somebody's just trying out, but it's been well researched, been well documented, and people are aware that it worked, and that's why they're choosing.
Evidence-based doesn't just mean that we're going to the textbooks and we're going to the research to find out, but it also means that whenever we're working with clients in our caseload, we're also taking constant data, wondering how they're doing and identifying changes based on the programming we have in place. The reason I love ABA and the reason I love what I do is because I'm always right. And what I mean by that, and what I mean by that is every time I put an intervention in place, I'm looking at the data. I'm looking at how the student's performing, and if the if we see increases in positive behaviors, then we know that's effective, and we're going to keep that going. If we don't see any change or things get worse, well, then we're going to change it up, and we're going to find something different. And so so evidence-based both means that we're looking at prior research, and we know that's what's effective for certain circumstances. But then we're also looking at the example, the current status of the client and what they currently need, and based on the data, we can make changes, and that evidence is driving our intervention.
I think the beauty of our program as well is that that's not just for a handful of kids that have intensive needs, but it's for the entire population of the school. So the behavioral practices of the entire school building are supported.
Who would be appropriate for our caseload is using data taken from the PBIS behavior stuff, and we see using the referrals, what kids are getting the most referrals, using that data, who would benefit the most from our support.
Now, what are some of the outcomes that have been demonstrated since the inception of this program? You could share.
Sure. I think Dan and Tara could probably speak some specific school, but I think the big picture that is sort of my responsibility to look at, that I think I'm most proud of for our program and the really great work that these consultants are doing, is that we're really finding the right level of care for kids at the right time. So rather than, we're trying to really focus on being more preventative, catch kids universally, keep them in the universal with the very little effort. But what the outcomes are showing is that we're getting the kids the right level of care because we're trying what's least restrictive in accessing their education, but most appropriate. And we're able to really capture quickly with the data that we're collecting whether that's the right fit or not, and make appropriate referrals. So if a kid needs a higher level of care, we're able to make that referral quite quickly. We don't wait until it's sort of spiraled out of control. As well as a lot of times we can capture them in the data prior to even having our level of intervention, and making sure those pieces are all in place before there's this implosion or really important for a student. As well as what I think is a great concept that happened vicariously is that when kids need a lower level of care, we're also able to transition kids from a less restrictive intervention much more quickly because the level of care below them is consistent. So it may not be as intensive, but the response is the same, the language is the same. So if a kid is coming from an alternative placement, an alternative school, their ability to step that kid down back into the school with a high level of support, whether it's intensive CAT BI in the school and then down to our program, but regardless, there's a little more of a continuum of care that allows us to transition them and have a less intense level of restriction, or have that level of restriction for a less amount of time so that the kid can perform on their own and really promote that care.
Yeah.
I think there are two big outcomes that come with this program, and that's one, the specific clients that we're working with in the school, where there are two outcomes there. Either they need a higher level of support, and we can support them in any way they need that, or we help them bring them back down to the general education setting where they don't need a higher level of care, and that's really the goal. And so that's one outcome that we give to schools. The other one is the school-wide benefit that we've touched upon many times, and that's we're providing consultation to teachers and all the staff in the school. And then we're also really reinforcing the values of positive reinforcement in the schools and exemplifying the behaviors we want to see increased. And so by working with my experience in schools prior to working for this team was a whole bunch of firefighting, going from one problem to another and a never-ending kind of race. But now when we're taking the data, when we're using the research, when we're using effective programming, we can stop firefighting and start getting to higher levels. We can start providing better supports when they're needed, rather than once they're already explosive and having a hard time.
Kind of that idea of trying to get upstream and ahead of a problem before it really turns into a big problem. But at the same time, once you get that system in place, you still have to operate downstream and deal with some problems that have developed into bigger issues over time. And I think that's one of the cool things of this position. I think one of the interesting outcomes is that they kind of do both things at the same time. They're doing a lot of preventative work, and they're doing a lot of work upstream, and they're also managing some of those higher end behaviors downstream, and having it's almost like you're pushing the pyramid both ways at the same time, which is a great to be able to do.
I think the reality and a really concrete outcome is that kids are spending more time in classrooms. They're spending less time out of their classroom in planning rooms or having some higher level of support, and more time in their classroom. These guys do a lot of work really pushing and supporting teachers on supporting the kids in their behaviors in the classroom, but also just really setting up plans that make the classroom the place where they want to be, and they're accessing their education in their community that they're going to grow up in with the peers and the adults they're going to grow up in, which is a really important outcome.
I would also argue that part of the reason through this do a lot of training, a lot of working with teachers and support staff, and really giving them the tools to redirect students appropriately in the classroom without needing to access a higher level of support like self and.
As the goal with a lot of our programs is really to work ourselves out of a job. Ideally, the school develops the capacity to do what we do on their own, and we can step out and move on to something else. They manage it independently.
And there's a perfect way to close, because believe it or not, our time is up. I know we could talk about this for hours, but you have really given us a good snapshot of this terrific program. So I do want to thank my guests, Matt Habedank, Amy Irish, Tara Lawyer, and Dan Biebernitz, for sharing their insights on the benefits that the NCSS School-Based Behavior Consultation Team brings to partnering school. Now, before we go, it's time for the NCSS Factoid of the Month. Even though the month of September serves as Suicide Prevention Awareness Month, at NCSS, we want to make certain that this topic is in the forefront 24 hours a day, 7 days a week, 365 days a year. Among the many specialty services made available to the community, NCSS offers prevention programs by facilitating mental health first aid and youth mental health first aid trainings. In addition, we have adolescent services, community services, outpatient crisis, and mobile crisis available in your time of need. NCSS provides confidential services and programs to individuals struggling with suicidal thoughts. NCSS is here for you with services to assist if you or someone you know is struggling with suicidal thoughts. You can call our crisis line at 524-6554. NCSS, you may not know us until you need us. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about the NCSS School-Based Behavior Consultation Team and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.